Here we are at New Image Advanced Laser Skin Center, and we're doing stem cell umbilical cord IV infusion. And this is Gary, and this is Jesse, and this is a slow IV infusion of diluted umbilical cord stem cells. So these umbilical cord stem cells are the ones that are multipotent and can change into multiple lineage of cells. Basically, they're attracted to any inflammation or any degradation in his body. So anything that's been injured, like the cartilage in his knees or the tendons in his shoulders, or the Achilles tendon that was repaired earlier but still has an atrophied calf muscle. So these umbilical cord stem cells are also mixed with multiple growth factors: vascular endothelial growth factor, interleukin 1A, anti-inflammatory protein. So there's tons of things that these cells can do when they come in the body. They start working immediately. So they're honed in, like all these inflammation that he has, cytokines, all these leukotrienes, anything that's inflammatory markers will draw these cells to those areas. And they don't just turn into those cells, they recruit things, and they produce things now called exomes that will actually recruit more cells, their own stem cells, to these areas of repair. They're done in a series of 2 shots. So this slow IV push, 2 to 4 weeks later, we repeat the process. Patient starts getting benefit immediately, but we tell everyone it can take 4 to 6 weeks to start to feel something, and up to 3 to 4 months to repair cartilage, and possibly up to 6 months to repair neuro tissue. So these things cross the blood-brain barrier. They've been used in multiple studies, 20,000 studies, for anti-inflammatory purposes and rebuilding regenerative stuff. They're also been used pre-transplant to reduce rejection. They've used in cystic fibrosis because they produce antimicrobial proteins. They've been used in MS, they've been used in Parkinson's, they've been used in osteoarthritis, rheumatoid arthritis. There's over 120 conditions we can use for these things. Procedure is very safe, very easy. They're FDA screened by the tissue bank for the donors. And the procedure is very easy. There's no other surgical thing that needs to be done. They are immunoprivileged cells. There's no HLA typing, no ABO incompatibilities because there's no ABO on top of the cells. These things are easy. How you feel, Gary?
Perfect.